Welcome to the DoubleACS Daily News for December 27th, 2016. Flu season is in full swing and the City of Attleboro still has flu vaccinations available for residents. We spoke to Attleboro Public Health Nurse Jaquie O'Brien about where people can get their flu shots.
So this fall, we started doing our flu clinics. We worked with some of the pharmacies to help immunize people in the city. Also, we, health department and the school department, had clinics in the schools to immunize children in the school system. At this point, we still have flu vaccine available, and we are doing it by appointment in my office at City Hall. People can call 508-223-2222, extension 3244, to schedule an appointment. And with the state-supplied flu vaccine, I am limited to doing children 6 months to 18 years of age and adults who are 19 years and older who have no insurance. People who do have insurance, we have to direct them back to their private physician or to the local pharmacies to get their flu vaccine. Flu vaccine can be given throughout the flu season. Each formulation has a different expiration date, which is generally anywhere from April to the end of June. We're seeing light activity so far this year that's being reported to the health department in terms of flu vaccination, and it's still a good time to get your flu vaccine. It does take 1 to 2 weeks to build up immunity, so again, we just encourage people as a good preventive measure to get the flu vaccine. Well, you know, I hear this a lot every year. People will tell me that the flu vaccine causes them to get the flu. They feel really lousy afterwards. So there are a couple of things that can happen. Because it does take 1 to 2 weeks to build up immunity to the flu vaccine, people can be exposed to the influenza virus and they might not show any symptoms, and then they'll start to come down with it, and if it's during that period while their body is building up immunity, they can absolutely come down with a case of the flu. But it is not due to the vaccine because it's an inactivated virus. The other scenario is sometimes we have shifts in flu vaccine because they base the formulation of the vaccine on the predominant strains for the year before. Sometimes we can get shifts in the virus and they might not necessarily be protected by the vaccine. But again, it is a good preventive measure and we do encourage it. Other things that we always recommend too are good hand washing, good cough etiquette by coughing into a tissue or into the corner of your elbow, staying home when you're sick until a fever has resolved for 24 hours without the use of any type of aspirin or Tylenol or ibuprofen or anything like that, again, just to help prevent spread of the disease. So one of the other things that came up this year is, and it's disappointed a lot of people, one of the formulations for flu vaccine is the nasal spray, flu mist, and we did not have it available from the State Department of Public Health this year. In June of 2016, the CDC came out with a statement. They had been studying the efficacy of the vaccine, and they found it wasn't being as effective as what they hoped. So the CDC is currently working with the vaccine manufacturer to study it and hopefully have an improved formulation so that nasal mist would be available in future flu seasons.
That's it for today's update. For DoubleACS News, I'm David Angel.